My name is Ananya Datta, and today I'll be presenting on the genetic susceptibility to infectious diseases. So first, just a little about me. I'm a rising junior at the Academy of Allied Health and Science, which is a high school in New Jersey that is focused on medical-based learning. I'm a varsity high school gymnast at my home high school, as well as an Indian classical dancer outside of school. I also volunteer at a free community clinic in my town, as well as at a hospital, while also being a local EMS cadet. These are all very important to me because I'm extremely interested in the medical field and definitely want to pursue a career in it in my future. Finally, last summer, I was part of the Rutgers-Wise research program and published my own DNA sequencing results on the NCBI database. So first, why should we care about infectious diseases and why are they important? Infectious diseases are disorders which are sometimes harmful, caused by various naturally existing organisms. These organisms can include viruses, parasites, or bacteria. Globally, the three deadliest infectious diseases include HIV or AIDS, tuberculosis, and malaria. And finally, in 2019, even before the pandemic, an estimated 13.7 million people globally died from an infectious syndrome. Seeing this large number even before the COVID-19 pandemic shows that infectious diseases are and always have been a major problem in our world. So what are some examples of these widespread major outbreaks? So we know that infectious diseases have always presented a significant global health problem. Just in the 21st century, major pandemics have included the 2003 SARS pandemic, the 2009 swine flu outbreak, the 2012 Middle Eastern Respiratory Syndrome coronavirus outbreak, the 3-year-long Ebola virus, the 2015 Zika virus, and of course, finally, the 2020 to 2023 COVID-19 outbreak. These 6 pandemics have just occurred over the last 20 years and are just a grouping of the major pandemics within this time frame. However, there are many more infectious diseases that have not caused major pandemics, but have still been causing a great amount of burden on many countries. So how are countries expected to control these large numbers of cases happening almost daily? Well, the truth is that not all countries are able to effectively attack infectious diseases. Underserved countries around the world experience significantly higher mortality rates and a substantial economic burden that comes from infectious diseases and pandemics. Due to a lack of resources, they cannot administer as many vaccines and accommodate frequent hospitalizations, increasing mortality rates within the country. In this graph, you can see that the projected labor force lost by year comparing the year 2000 and the year 2020 in Africa. These countries experienced a much greater loss of their labor force in 2020, meaning that there are extremely high unemployment rates within these countries during this time frame, obviously due to the pandemic. This means that families are not making enough money to support themselves, and the country's economies are suffering. Without enough money to even support businesses, there is little attention being paid to public health. So these solutions that are catered towards first world countries like the US are not realistic for underdeveloped countries, and there needs to be a more reliable solution that can help more people at once. Our current solution to fighting viruses and infectious diseases is vaccination, which comes about through the idea of germ theory. Germ theory is based off the fact that pathogens spread disease. Scientists use pathogen-centered modeling to track disease spread, which allows them to contain outbreaks and see where more outbreaks are happening around the globe. However, it does not factor in biological phenomena of affected individuals, whereas host genetics does. Host genetics revolves around hereditary factors that can affect susceptibility to infectious diseases, like genetic alterations or malfunction passed down through generations. These could change how infectious diseases affect specific individuals. Host genetics is already considered with conditions like cancer or heart disease because a case of it in someone's immediate family means that a patient is more susceptible to it due to just similar genetics. To study this phenomena, in 1988, scientists in Denmark ran a study on 960 adopted families. The children in these families were adopted from an early age and knew little about their biological family. The goal of this experiment was for scientists to evaluate the risk of a child's death due to a specific cause. Specifically, if the biological parent were to succumb to an infectious disease before the age of 50, they wanted to see the child's risk of dying from that same infectious disease. The results found that the child had a 5.81% greater risk of dying from the same infectious disease as the parent. This large number is alarming, but it also confirmed that there was some biological link between the susceptibility to infectious disease that is passed on through generations. So could this idea be used to explain a possible reemergence in infectious diseases? Well, recently, in the 21st century, diseases like measles, tuberculosis, and malaria, as well as whooping cough, have seen a resurgence in post-pandemic society. In the graph, you can see that the gray lines indicating re-emerging infectious diseases are scattered throughout the 2000s and 2020, while the emerging diseases were already causing great pandemics. The old infectious diseases that were re-emerging could indicate a new era of infectious diseases that scientists cannot explain to the fullest. Here, again, you can see the statistical incline of malaria globally from 2019 to 2022. You can see in 2022 that there was an increase of almost 5 million cases of malaria, which is much greater than the past 3 years, even though the death caused by malaria has decreased. Now, knowing that host genetics have a significant effect on how infectious diseases are contracted, it could be predicted that some percent of these cases were due to genetic factors that should be studied and further considered when looking at outbreak statistics. And here, confirming this idea, we can see that 25% of the variability in contracting malaria is due to genetic factors, like traits that alter blood cell shape. And an even greater correlation, 70% of this difference in susceptibility to COVID-19 is due to genetic factors as well. This is because some individuals with a particular gene have T cells that can detect the coronavirus due to seasonal strains of the same disease. Like malaria, both genes decrease an individual's susceptibility to COVID-19. Using this knowledge of host genetics and how it can actually help an individual in both of these cases, the idea should be taken into scientists' advantage to see what possible next steps could be taken to lessen the number of infectious diseases globally. So in summary, host genetics play a large role in the susceptibility to some infectious diseases, including malaria and COVID-19. And it's important to take the same caution when screening for common hereditary diseases, while also doing the same for infectious diseases to make sure a patient has the maximum amount of safety that they can. Malaria is just one of the examples of a disease that has been a danger to the world for decades, specifically underdeveloped countries within Africa. The host genetics theory could be applied to find solutions in these specific locations. So, how can host genetics truly be implemented into the world to lower infectious disease cases? For one, genetics can further the creation of drugs to cater towards a percent of the population with similar genetic susceptibility. Doctors can also create personal therapeutic plans to best manage a disease, knowing how a person's genetics will react to certain medications and therapies. Genetics will also allow for the prediction of susceptibility within certain groups and allow for the isolation of at-risk groups to contain specific infectious diseases to a certain location. Finally, consumer personalized genetic testing makes them aware of the risks that could come with specific genes that they have and how they could stay safe from them in the future. Here are my references, and thank you so much to the Global Health Leaders Conference for allowing me to spread awareness on important topics that should be considered for a healthier future. And thank you so much for listening. If you have any questions, feel free to contact me at this email, and have a great day. Thank you.